Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have vasopressin antagonists. Vasopressin antagonists mainly include we have two vasopressin antagonists which are conivaptan and tolivaptan. Conivaptan and tolivaptan are the vasopressin antagonists. These are actually approved by FDA. These are approved by FDA for the intravenous administration in mainly in case of hyponatremia. So these are used for IV administration for hyponatremia. So this conivaptan has high affinity on both V1 receptors and V2 receptors, whereas tolvaptan has higher affinity mainly in the V2 receptors more commonly than the V1 receptors. So then the other vasopressin antagonists are we have relcovaptan. This relcovaptan is preferentially a V1 antagonist, whereas we have lixivaptan. Lixivaptan is a V2 antagonist. Lixivaptan is a V2 antagonist, whereas conivaptan is V1 and V2 antagonist.
thank you and thank you for watching.